Mental health is a crisis now, particularly among our youth. Mental health in our youth has been challenged even before the acute phase of the COVID-19 pandemic. I think that the impact upon the technology and particularly social media has significantly exacerbated, significantly made worse these mental health challenges. I think that that we need to destigmatize the issue in terms of mental health.
With your busy schedules, what is your secret to staying fit, both physically and mentally sharp?
In a new twist to clown world, HHS and the President's Council on Sports, Fitness, and Nutrition brought on the very confused Admiral Rachel, aka Richard Levine, to discuss, and I will quote from their website, the challenges and opportunities to improve the mental health and well-being of Americans. To sum that up, the Biden administration selected an out-of-shape person who doesn't even know what gender they are to lecture people about mental health and physical fitness. And if you think that sounds weird, you must hate women or something, because he was actually named one of the Women of the Year. As far as mental health, I think it goes without saying that Levine should be one of the last people ever lecturing about that, considering he doesn't even know what gender he was born as. But when it comes to physical fitness, all you have to do is look at Levine to see that he's not exactly living what he's preaching. On a related note, it is pretty funny that when Rachel was Richard back in high school, he was on the same football team as Mark White Rage Billy.
I want to understand white rage, and I'm white.
Now, if you like to be lectured by people who have a mental illness, or you just like to torture yourself, enjoy the rest of the highlights.
Admiral Levine, of course, you oversee a giant swath of the work that HHS does when it comes to health and to mental health in particular. And I wanted to see if you could talk just for a minute about what HHS is doing right now on youth mental health, given that there's this completely new environment where kids are now online so much more.
Well, thank you very much for the opportunity to be here, and you're entirely correct. As the second gentleman had talked about, mental health is a crisis now, particularly among our youth. As we were talking beforehand, I'm a pediatrician, adolescent medicine specialist in academic medicine for many years before I was able to go into public service and public health. And so I know firsthand from my clinical experience how important it is about the intersection between physical health and mental health. And so this extension between fitness and physical activity and sports and nutrition and mental health is sort of an absolute natural fit. You know, mental health in our youth has been challenged even before the acute phase of the COVID-19 pandemic, but certainly the COVID-19 pandemic affected everyone, and it really impacted our youth. So now that we're out of the acute phase of the pandemic, we're still struggling with the mental health of our youth, as our great Surgeon General has been highlighting. So HHS under Secretary Becerra has been dedicated towards improving youth mental health. There are many programs under HRSA, under SAMHSA, and a whole alphabet soup of different divisions that we have at HHS that are concentrating on the workforce that the second gentleman was talking about, and then different programs to support youth. It is a really important time, however, to also mention SAMHSA's program of 988. 988, the suicide hotline. It's absolutely critical that everybody knows about that parents know, that youth know about 988.
Is it just like 911, pick up your phone, dial?
Dial 988. Of course, most kids don't use phones to dial, they text. And so you can text 988, you can chat 988, and you can get to trained counselors that can help young people and adults as well. And so very, very important to highlight that resource.
Can I also ask then, who should use 988? Like, if you begin having suicidal thoughts, it sounds like that would be a good number to call. But if you're just feeling maybe like really down, really depressed, you've never felt this low before, and it's been going on for a while, is that another good time to call 988?
Absolutely. I think 988 is a resource for mental health challenges, as well as for having overt suicidal thoughts. And so they can help connect you to local resources in order to help.
I did want to ask, since you do have the background as a pediatrician, I mean, how bad is it right now for kids who are growing up? I mean, I know to a certain extent, you know, bullying, teasing, that has always been something I think that, you know, a lot of us dealt with, whether you're online or not. But what does it mean now that so many kids have these social media profiles and that so much of what they're doing online is with these anonymous individuals?
I think that that the impact upon the technology and particularly social media has significantly exacerbated, significantly made worse these mental health challenges, especially the issue of loneliness, which the Surgeon General emphasizes. There are some statistics that youth might spend, less than 1 or 2 hours a day with other young people, and so really they're very concentrated on their phones, and it isolates them. And you'd like to think that social media might bring people together, but it's not really what happens for youth. And so that's why the sports, as emphasized by the President's Council, is so important, because sports naturally brings young people together, and that's why participation in sports is so important. When we were in college, back in the day, one of the biggest activities was dinner. You'd go to dinner and there'd be a buzz of conversation at dinner, and with young people, college students studying many different things, talking about their studies, talking about their social life. You walk into the cafeteria now, it's pretty quiet and everyone's on their phone. And it's just a very different experience. It's a very different social experience. And that would be an example of some of the challenges that young people face.
Really, what at the end of the day is going to make a difference for these young people in terms of how they use social media?
I think that it is incumbent upon the federal government, and we have a task force at HHS working on that, and it's really actually with other departments as well, looking at safety for young people on social media. And so I think it is incumbent upon the executive branch with the Congress to make sure that social media is safe, to try to limit misinformation, disinformation on social media. I don't think that the federal government is going to change the culture about that. I think that really is going to need to involve all of us, not only in Washington, but in local areas, communities, to really try to help young people with sports and with other activities to be out there and interacting with their peers as opposed to just on their phones. I don't think that can just come from Washington. I think that we need to destigmatize the issue in terms of mental health and challenges to mental health, and I think that's critically important. But I also think it's important to kind of view it as wellness, not only physical wellness. We've been talking about physical activity, talking about nutrition, but also mental health wellness. A metaphor that I've often used in young people in talking with groups is the eye of the hurricane. Right, so we had storms there've been tremendous storms over much of the country, and we're entering hurricane season. Well, and the winds of the hurricane are very, very strong, and that's sort of a metaphor for our lives, which are stressful. Right, we all have stress. Young people have stress, but in the eye of the hurricane, it's quiet and it's calm and it's peaceful. And so we need to help young people find something to help center themselves. And so that's different for every person, different for every young person. It might be physical activity, it might be sports, it might be art, it might be music, it might be their faith, it might be their pet, but something that centers them. And I think everybody needs to find that, and every young person needs to find that for themselves.
I'm just wondering if we can expect anything from HHS or even wider the President's Council trying to have some awareness for mental health, mental wellness coming around that time.
Well, there will be activities of the President's Council during that time highlighting those amazing events. And we're just really so thrilled and excited by the work of the President's Council with Dr. O, the co-chairs, Elena Deladon and Chef Jose Andres, and all of the different members, some of whom are here, who are just doing so much work both in Washington, but actually locally as well, because of course they come from throughout the country, highlighting these critical issues, highlighting the importance of physical health and mental health, the importance of nutrition in terms of food security and nutrition security, and the parallel work in terms of food as medicine. And so when we have great events like the Olympics and the Paralympics, then it just highlights all of these different issues.
I know also the Biden administration has turned to social media and social media media influencers in order to get out certain messages that they have and trying to be able to promote certain things that they are doing with the government. And I'm wondering if there has been any consideration to, using some of those most loudest voices on social media, maybe not necessarily athletes, but people who the youth follow and pay attention to, and be able to use that to kind of get out some of the messages about some of the mental health impacts social media can have.
So there are, of course, social media platforms that are used by the White House. There are other platforms used by HHS and other departments, including for the President's Council. Primarily, we rely upon X, which is formerly known as Twitter. Is that what we say now?
Yep.
But there are different platforms where we try to get our message out, because we know that young people and adults are using social media platforms, and so we want to be there so that they can to highlight the great work that the President's Council is doing and that we're doing across HHS.
How do you think about crafting those messages where it's sort of like, hey, you're on social media, get off social media, have a good day?
Well, so it isn't that social media inherently is bad. It's a tool, it's a platform. And so we don't want people to only be on social media. We want young people to be playing sports, of course, to be in school, to be doing other activities, and to be interacting with their peers. But we know that young people are on social media, their parents are on social media, and it exists. It's not going to go away. And so even though there are recommendations that make sure that it's safe, that there are regulations that it's safe, we're going to use the tools that we have in order to get our message across.
With your busy schedules, what is your secret to staying fit, both physically and mentally sharp?
Well, as I mentioned, I think that it's important for all of us to have some activity in which we can center ourselves to deal with the stress that all of us face in life, both in our personal and professional lives. So for me, I will either go for a walk, or I'll swim, or I'll do a bike, and keep myself centered the best I can.
Sure.